President Trump is touting a big victory with the passing of the American Health Care Act through the House.
That bill now has to go through the Senate, where it won't be nearly as easy. Pepperdine University Professor Shire joins us now this morning. Good morning.
It's great to be here.
Good morning.
Okay, so what changes will likely be needed to get the health care bill through the Senate?
Well, as you heard the senator say, they're going to pretty much be starting from scratch. That means everything's on the table. There are things like funding for Planned Parenthood, some of the mandate reforms, some of the tax allocations and where the money is going to go. All that's going to be part of the legislative process. I mean, this really is government passing laws and making policy through compromise and negotiation.
Now, Professor, we saw lawmakers use the nuclear option to get Supreme Court Justice Neil Gorsuch through. Do you think they might have the ability or the willingness to do that this time?
Well, they have the ability. They won't need it in this case. I mean, the Affordable Care Act was passed through what's called reconciliation. It's a technical thing, but basically they only need 51 votes to pass it. And so they don't have to worry about the filibuster, about this getting 60 votes to get the legislation through. They'll be using the same process in this part of the negotiations to actually make it happen.
And what do you think it's going to mean in 2018 for House members who voted for the bill?
Well, you've got to remember this election surprised a lot of people back in November, and America is very diverse. So for some of those districts, it could be a big issue. For a lot of them, I mean, a lot of the momentum that came from Donald Trump getting elected is going to be behind him on this.
Will this be the issue that could cost so many Republicans their seats?
Well, it's going to depend on how it plays out. I mean, the Senate's going to come up with their version, then they're going to negotiate, and then they're going to pass a piece of legislation. How that final piece of legislation is spun could work for and against Republicans and Democrats. I mean, this really is going to be a pivotal election going forward in 2018.
And, you know, some Congress members say that they didn't even read the bill. Is it uncommon for them not to read it before they sign it?
People.
Well, there's the famous Nancy Pelosi quote, we'll have to pass the bill to see what's in it. I mean, there is an aspect. I mean, the Affordable Care Act originally was over 2,000 pages. I think I'm one of the few people on earth who read it. Most legislators rely on staffers actually to read and summarize the bills, and then they vote based on what they understand the bill to do.
So did they learn anything from the first time of this not passing, getting so close and then having to pull it off the table? Can they do it this time?
Well, the challenge is this. The Affordable Care Act had some kind of design flaws in it, and we're starting to see those. Some states don't have plans in their exchange. The prices are skyrocketing. This administration and this Congress was going to have to fix some of those holes anyway. So all of this was going to be on the table. It's really hard to reinvent an industry, and that's what we tried to do in 2010, and that's what we're going to have to try and do in 2017.
All right, Professor, thanks so much for the insight. It must have been some interesting reading for you all.
We're going to have some great drama coming forward here.
Looking forward to that.